everybody. Welcome, 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 and thank you for joining us this afternoon or evening, depending on where you are. We have a really wonderful, fun event planned for you guys tonight. As many of you know, or maybe you don't, but this week is fertility, or this month is Fertility Awareness Month. And so we really wanted to take a pause and we've been doing this across our social media all week. And just share stories about fertility journeys, many different kinds of journeys of people who are pregnant and have had a hard time getting pregnant, and journeys of fertility preservation. So we have two really, really special, very, very special guests for this event, and one of them is Lillana Vazquez. The other is Kara Cerrone, and they're both going to share their stories generously with us tonight. And Lillana is a fertility advocate and also an e-host. She herself has a fertility journey. She is currently pregnant, which is very exciting, by IVF. And she's going to talk to us about how this all started. And she is also sort of here to represent the Latinx community and has a very special perspective from that stance as well. Kara is here, and she's actually in the clinic with us. She's just 2 rooms down from me right now. She is one of our very special employees at Kindbody. She's the Senior Director of Enterprise Partnerships. So what that means is that Kara actually plays this role at Kindbody, where she is working around the clock to create access to fertility care through employers. So that is her purpose in life, and she has a different story to share. But interestingly, both of their stories began with just information. Both started with learning about their ovarian reserves and learning that their ovarian reserve or their egg numbers are low. And that was kind of this jumping off point for each of their journeys. And then after that, they were quite different, but they're going to share their stories, both just sort of what happened and how they felt through all of that tonight. So we're looking forward to that. And that's obviously the good stuff in this meeting. What I'm going to do before we do that is just sort of very quickly go through just give you a small amount of information, both about Kindbody as well as fertility and fertility preservation and infertility. So I'll start there. I won't take up too much time because we really want to have a lot of time to hear from Lillana and Kara. So just an introduction to us, for those of you who are not familiar with Kindbody. We are an all-encompassing, all-inclusive women's healthcare and fertility clinic. And we have clinics, actually, we're growing. We have clinics across the country. The original was in New York, and then LA, San Francisco, and now we have a clinic in Los Altos and Princeton, New Jersey, and Atlanta, Georgia, and soon to be Denver and Austin. And so we are growing, and our mission here at Kindbody is to make fertility care and women's health care accessible and unintimidating. So we do that in a lot of ways, but we try to create an environment where it's easy to access information and easy to feel cared for and safe and warm and welcomed. And again, the most important thing is to provide care for everybody. So again, as I mentioned, part of what Kara does is to try to facilitate employee coverage of fertility care. And then we also try to keep our prices as low as possible, again, to improve access to this type of care. As I mentioned, we offer all types of fertility care. So we care for people who are trying to get pregnant. We care for people who are just interested in learning more about their fertility, and those who are trying to preserve their fertility. We also have gynecologists and provide comprehensive gynecologic care. And we also, provide services to the LGBTQ community, and also Tracy, who's here tonight, she one of her big missions is actually to provide holistic care. So we have nutritionists, we have therapists, we have acupuncturists. So we are trying to deliver care in the most holistic way. And I guess before I get started, I forgot to mention this. As I go through this informational session, and as Liliana and Kara share their stories, we encourage you to ask questions. We love having an active chat. We have some of our own fertility specialists here in the chat to answer your questions. So we're going to try to get to as many of those questions as possible, but please send them to us in the chat as we move through. So one of the things that's really the cornerstone of our mission here is to help people access information. And you're going to hear from two people today whose whole journey started with getting unexpected information. And we feel it's really important for everybody to understand how their bodies work, and where they stand, to assess what their current fertility, or at least their ovarian reserve or egg numbers are. So we really believe that information is power, and we want everybody's journey to start, even if you're not even thinking of getting pregnant anytime soon, or not even sure you want kids, to just start learning about yourself and kind of where you're at, and to start thinking and planning for your future, to give you all the information and tools that you need to try to have the family that you want in the future. So the first step is getting that information, and how we do that is with an assessment or fertility evaluation. So whenever an individual comes into the clinic, they have an hour-long assessment that starts with a conversation with one of our fertility specialists. It also involves checking on egg numbers or ovarian reserve, and we often do that with an ultrasound as well as some blood work. In individuals or couples who are attempting to get pregnant and having a hard time doing so, we also check other components. We check the sperm, we check on the uterus and the fallopian tubes, and we also do preconception counseling, where we help people sort of prepare and optimize for a pregnancy. Just to go sort of back to the very basics of all this, for us as females, we are born with all the eggs we're ever going to have. And we're losing eggs with time, and that is a normal process. So as we get older, we lose eggs, and the quality of the eggs decline, which is why we tend to see in populations of people a general decline in fertility as women age. It's not fair. It's actually a little bit different in males. Males have they have stem cells in the testicles, and there's some regenerative capacity there, so they can produce sperm throughout the course of their lives. And you tend to see that impact of aging on fertility a little later in men than you do for women. So that's just an unfair fact of life. Part of what we do when somebody comes in for an assessment, in addition to sharing this information for them, is we can measure your egg numbers, right? We can get a sense from the AMH and the follicle count, sort of where you stand in terms of your egg numbers. Unfortunately, we can't measure the quality. That's largely based on an individual's age, but we can sort of get a sense, again, of the egg numbers. I think one of the most important things that happens at these assessments is it really encourages people to be proactive and thinking about what kind of family do you want to have? And even if you're not sure, to start thinking about those things. How old are you now? When do you, in your most perfect world, when do you think you would like to be starting your family? How many children do you want to have? And then taking all that information and then helping to formulate a plan that works for you. We spend a lot of time in our lives planning to not be pregnant. And as females, we get a lot of information about that, right? So, I mean, I can hardly remember a time when I went to the gynecologist in my 20s where they didn't ask me what I was using for contraception. But I don't know if anybody ever asked me about the family. When am I planning to start trying? Am I in a relationship? And I do think that in general, healthcare providers are getting better at this. But it's important, and it is a huge part of what we do here at Kind Body. This is just, there are other things that can sort of impact fertility. We talked about age, which is certainly the most important thing. But as I mentioned, we do like to approach things from sort of a more holistic standpoint, maintaining a normal body weight, avoiding certain exposures, adding certain supplements, taking care of your mental health. Those are all things that are important for general well-being as well as for fertility. And we're so lucky here, thanks to Tracy and her team largely, to have services to support people and optimizing their health in whatever type of fertility journey they're having. Again, as I mentioned at the beginning, we have just really sort of two different types of fertility oriented services that we offer. And there's fertility preservation, which is for individuals or couples who are not ready to get pregnant, but want to do some planning for the future. And then family building options for people who are actively trying to get pregnant. Within fertility preservation, that usually happens in sort of one of two forms, either freezing eggs or freezing embryos. Both of these are great options, and every individual will have to decide what's best for them. Freezing an embryo requires a sperm source, either from a partner or a donor. And freezing eggs allows an individual to keep their options open for a sperm source in the future. When we freeze eggs, when an individual freezes eggs, again, as I mentioned, the upside is that she can use those eggs however she wants in the future if she needs to, but you can't tell about the quality. So that's one of the hard things about freezing eggs, is that even when we look at those eggs under a microscope, we can't tell anything about the quality. We can sort of make guesses based on her age and the number of eggs frozen as to what the chances are of those eggs resulting in a baby in the future, but we can't definitively tell if they're normal or not normal. When somebody decides to freeze embryos, they're committed to a sperm source. You can never unfertilize them. So, that would be not something to consider, not necessarily a downside. But you can start to learn a little bit when we make embryos. You can start to see if the eggs fertilize and how the embryos develop. We can even genetically test the embryos to see if they're normal or not. So there's a lot more information to be obtained. One is not better than the other. Everybody just needs to decide what's best for them. For family building, we often, there are multiple treatment options for those who are having a hard time getting pregnant. After an evaluation is completed, the provider will help that individual or couple sort of decide what the best path is for them. And sometimes it involves doing inseminations. Sometimes it involves using a partner sperm, sometimes a donor sperm. IVF is actually in the process that actually is very similar to egg or embryo freezing. Everything that happens up until the day that the eggs are taken out or harvested is very similar. The main difference being is that the egg is always combined with the sperm to make an embryo. And then the goal is to shortly thereafter transfer the embryo to see if a conception occurs. For individuals who can't carry a pregnancy, or for same-sex male couples, sometimes that involves also using a gestational carrier or even an egg donor for some couples. But again, all of those things, all these options are available, and your doctor, your reproductive specialist can sort of walk you through what those options are and help point you in the direction that's best for you. And again, we're going to hear two fertility journeys today that started from the same place. They both started from learning about AMH and learning about egg numbers, and then sort of have gone in two different directions. But I think it's important to remember that everybody's different, right? Everybody comes from a different place, gets different information when they get here based on who they are, what their fertility is, what their ovarian reserve is, what their current situation is, and what their current goals are. And then, needs an individualized plan to meet those goals. And so I think it's really important as we talk about these journeys to remember, that everybody's different. Everybody's journey is different in many ways. And to not compare yourself to other people. I think it's sometimes hard not to, but to use sort of other individuals who are traveling a journey with you for support, but not a comparison to make you feel bad, because everybody's journey truly is different. And then again, as I've mentioned multiple times, information is power, and we live in a day where we can plan, and we can, be proactive in trying to have the families that we want to have. And it's an amazing thing. And again, that's why we're here. That's what we exist to do, is to help you do that. And I'm going to let Amanda Lynn do, if you don't mind, Amanda Lynn. So we have two
Yeah, of course.
slides here about kind of the cost of everything, and then we'll get to the good stuff. We're going to let Lillana and Kara tell us a little bit more about themselves.
Yeah, so thank you so much. That's so informative. If you guys are interested in learning more, always visit kindbody.com. But one of our goals and missions is to really make fertility care accessible to all. And through that, we do work with insurance, which is the next slide. But here we really it's so important for you guys to know that we are here to support you, and we want to help you in your family building journey. So for International Fertility Awareness Week, we are offering a discount. So when you go to book your appointment at kindbody.com/book, use the code sharing. If you have any questions, reach out to us. But please come in and see us. It's so important for everyone just to know what your options are. And we're happy to offer you guys a discount for this special month. Thanks. Yeah, and we offer insurance too. So if you have any questions about what your insurance policy is and what it covers, reach out to us. But yeah, thanks so much. Let's get to the stories, the fun part.
I have a question, Amanda Lynn. Should they use sharing, or should they use self-love?
Oh, they should use the sharing. That's on me.
Okay.
I'm sorry.
Okay, cool. So everybody.
Yeah, please use sharing. Yeah.
Perfect. Excellent. Okay, now we're going to get to the good stuff. I think, I think we'll not pause for questions just yet. I'm going to stop sharing my screen. And then I think we're going to, maybe Lillana, would you be really willing to talk to us first? I think, again, as I've mentioned, I know your journey sort of started with your gynecologist. You were, as I understand it, in a relationship, but not necessarily actively trying. And you actually had a very progressive gynecologist who, and it wasn't even a fertility expert, who encouraged you to get some of this information that we've been talking about. And that was the start of what was a much longer journey than you were expecting it to be.
Yes, absolutely. And I'm so excited to be able to share this with all of you. And thanks to this incredible team at Kindbody for putting this together and for giving us the space to have this conversation and share these resources, and just make this more accessible to women across the board. I think that knowledge is power, and that is what you guys do. So thank you for that. And thank you to everyone that's in this chat now. I know we all have really busy lives, and I know sometimes we have Zoom fatigue at the end of the day, but honestly, this is so important to know whether you're ready to have a baby or whether you just want to know more about what's going on. So thank you guys for the space and the time to do this. So you're absolutely right. My fertility journey started in 2015. And I definitely was not looking to get pregnant or have a baby in 2015. I was working at the time what I thought was literally my dream job. I got to sit to the left of Meredith Vieira every day on national television and learn from the best in the business and one of the funniest and kindest people in this industry. And I was just thrilled to be working. I love my job. My husband and I traveled. And while we knew that parenthood was in our future, we just weren't actively pursuing it. And so I went for my routine exam with my gynecologist, shout out to Dr. Morgan in New York. And she is very much an amazing physician, and she's an incredible doctor, but she's also just one of those doctors who is just a human to human person and, craves connection and wants to get to know her patients. And so she kind of knew where I was career-wise, and we had talked about it. And she said, but you do have interest in starting a family one day. And I said, yeah, of course, one day. It's just not something I'm doing right now. And she knew my age. I was 35 at the time, and said, well, I think it's worth getting an AMH test. I'm embarrassed to admit that I had no idea at 35 what the letters AMH stood for. I think that in my 20s, I definitely had no idea. And I think a lot of women now still don't know what that stands for, but it's anti-Mullerian hormone. I share that when she asked if I wanted that test, I mistakenly thought she was asking me if I wanted a malaria test, because I would be traveling internationally somewhere where I could contract malaria. And I said, I'm not going anywhere. We don't need to do this. And she said, no, that is not what this test is about. This is about your ovarian reserve. And also 2 words I'd never heard. I knew I had ovaries. I knew I had 2. I didn't know they had reserves. And so she ran a test on me. I left, and sure enough, a few days later, I get a call from her office, and I immediately thought, this has to be bad news. What does this mean? I was between shows, so not in the best mental space in terms of being able to process this, but I wanted to take her call because I knew she wouldn't be calling me unless it was important. And that day she let me know that my AMH level was almost undetectable, and that it was on par with somebody who was either premenopausal or early stages of menopause. And again, reminder, I was 35 years old. I'm young, I'm healthy. I've never felt infertile. I didn't know what infertility felt like. And I couldn't believe that I was dealing with this. But what she said was, I want to run the test again. The number was shocking to her. And she said, do you mind coming in today? I said, not at all. So I went back in, we ran it again. I think it was lower the second time than it was the first time. And she immediately said to me, if you really want to be a parent and children are in your future, then I really think you should see a specialist. And so I broke down in tears. I had never considered the fact of how I would feel if the option to become a parent was taken away from me. And it was starting to feel like I was going to lose that option. And that's what's really important. I think it's not about, I want to have a baby now. I think that our options as women shouldn't be limited by time. It shouldn't be limited by choices that we make in our career. It should be limited by the partners that we have. And so we immediately started to see someone right away. So this was the end of 2015. I had polyps, so I had to have those removed. They did a full assessment, which is what Kindbody is talking about now. So you're doing a full panel because AMH is just one test. You need to see how all of these hormones interact together. I call it like triangulate to see a really clear picture of what's going on in your body. And also, most importantly, I had a transvaginal ultrasound, which sounds not ideal, and it's not. I've had more than I care to count, but it lets you really see your follicles. And I had never even thought to do something like that. I thought ultrasounds were only something that you did when you were pregnant and you got to see your baby. And so that kicked off a very long and painful journey for me. I saw several specialists, 2 in New York, 1 in Colorado. And the reason for that is because I just was never happy with the results. And the results for me, unfortunately, for many years were that I was never going to be pregnant, right? I was trying multiple protocols, different drugs. I was doing Follistim, I was doing Menopur, I had tried Gonal-F, I had tried, Clomid, all of these different hormones that you hear about in different combinations with different doctors. And my body just wasn't responding. And what I found was I thought that IVF was going to be a guarantee for a positive pregnancy test. And there is no guarantee with IVF. We have all of the science in the world and so many incredible tools. But I mistakenly went into this battle thinking, oh, well, I'm just going to do IVF, or I'm going to have an IUI and then I'm going to be pregnant. This is a easy solution. And it's not. It really isn't. And so you really have to be knowledgeable. You have to be your own number one health advocate to understand, what can we change? What can we do different? What can I do lifestyle wise to help myself? And in the course of doing all of that, I quickly realized that for me, I'm a really spiritual person. There is that, medical component of it, but there was also for me that faith component of it. And I talk about this a lot in an article I did for People and in the video that we put out. And there was so much power in surrendering to the idea that we just wanted to be parents. And there was something so special about that because it took the burden away from me. As women, we carry this burden, right, of infertility. It's always like, oh, something's wrong with her. Her body can't do what it's supposed to do. And when I kind of let that go and said, listen, at the end of the day, our biggest dream is just to be parents, whether that's through surrogacy or whether it's through a donor egg or whether it's through adoption. That is all that we want. And so it was a very long journey, but finally, we transferred an embryo October. Actually, I think it was October. No, it was actually election day. It was election day. We transferred an embryo, and that was the first time that my embryo actually took. We had done many transfers prior to that. And, there's a million different reasons why an embryo doesn't stick around. But that one did, and that's all that matters. And so I am a little over 6.5 months pregnant. I think I'll be 7 months pregnant in a week. So we are so happy. And it was a battle that I chose to fight. I say alone. I don't mean just alone. Obviously, my partner was super supportive and my mom was super supportive, but it is a battle that I chose to keep private. And there's a million reasons for that. One of the biggest reasons that I've kind of figured out is there's so much stigma and shame attached with infertility in my community, in our culture. As a Latina, I'm half Mexican and half Puerto Rican. Infertility and reproductive health in general just isn't something we talk about. It's not something that I'm comfortable or that I was comfortable talking about up until I really shared this news with everyone in my family. And I hope that sharing my story and reaching the Latinx community starts to change the conversation. Infertility it affects anyone. It doesn't matter what your ethnic background is. It doesn't matter what your age is. It can affect everyone. And that's really important for me. I think as Latinas, there's so many dangerous stereotypes that exist about fertility. I always joke and say that, for so long, my aunts would be like, oh, you're going to sneeze and get pregnant. You're going to get pregnant washing the dishes. It doesn't work that way. We're smart enough to know that is not how people get pregnant. But nonetheless, they push those stereotypes on us, and that can be really dangerous. And it can be really hurtful. And so I hope to kind of change that and stop these stereotypes and remove the stigma that exists, not just around infertility, but also around postpartum and even miscarriage in the Latinx community. We just don't talk about this enough. And it's something that we're shamed into silence about. And we know how destructive silence can be when it comes to topics like this.
Lillana, thank you so much for sharing all of that. You brought up so many things. You obviously you have so much self-awareness at this juncture about this journey that you have traveled. And you brought up so many things as I listen to you that I hear from people all the time. And so I just want to kind of tease those out and have you, and what you ended with sort of was this idea of sort of shame. And you said something very interesting. You shame about feeling like your body's not doing what it's supposed to do. Mm-hmm. And I think that that's something that's universal. And then you bring it up sort of in particular to the Latinx community and various stereotypes around that. Maybe I'll just start there. Well, actually, I want to touch on one other thing that is probably less significant. One thing you said to me that I hear all the time is, you assumed because you were healthy and you were young that you were fertile.
Yes.
And I hear that all the time. And it's interesting because there's a generation of women who are 30 right now, who they come in and they tell me, I ask you, what are you here today? Well, I'm going to be 32 next year. And they're already, I think it makes me feel optimistic. We're doing a better job disseminating this information that people need to think about fertility when they're in their 30s. And so they're already there to learn. And then I talk to women who are more my age and they're in their 40s. And we start to talk about, how this might be challenging. And I say, I'm healthy. I feel great. How can that be? So just that feeling young, looking young isn't connected to fertility. Family history isn't connected to fertility. Your ethnic background isn't connected to fertility. So it's unfair, as you mentioned, to make assumptions about your fertility based on any of those things. Feeling healthy or being healthy, you eat all the right foods and you exercise and you take all the supplements and you do acupuncture, all these things. It isn't necessarily a direct indicator of fertility or your ethnic background. Again, you're right. There's a stereotype. Latin, of course, Latin women are fertile. That's not true. It is true for some, but not others. So you're right. Just really, coming to get the information about yourself as an individual and not based on all these things. I think that that's a really great point. But I would love to hear just sort of more about, kind of your community in particular, or maybe comment. I mean, I think that the feeling of shame, that feeling like your body is not doing what it's supposed to do, is really universal for anybody who's trying to get pregnant and can't. So my first question is what did you do with that in real time? Like, now you've obviously processed it in such a constructive way, but when you were experiencing it, how did you deal with that?
I didn't. I was actually really, really bad at it. And looking back, of course, hindsight is always 2020. For whatever reason, and I talk about this really openly because it doesn't just apply to fertility. I think it applies to so many things in my personal life and my professional life. My mom raised my brother and I without a lot of help from my dad. And so my mom didn't have the luxury of taking a day off work or being sad or feeling blue. So I never saw that. All I saw from her was strength and perseverance and tenacity. And those are incredible lessons to teach our kids. But at the same time, you're also not seeing vulnerability. And you're not seeing how powerful vulnerability can be and how comforting it can be to share a story that is really painful with someone, to seek empathy, right? And to seek kindness. And so I wasn't strong enough at 35, 36, 37, 38, really, until I did some real work on myself with an incredible therapist. And that's why I think the mental health component of this is also so important. I just didn't feel like I could share that because I didn't know how to be vulnerable. I was never taught how to do that. I didn't see that in my own family. And so I kind of compartmentalized all of the loss and the trauma and the struggle and the pain and the isolation, all of these feelings that are so common, whether you're whether you're trying to get pregnant naturally or you're trying to get pregnant through IVF. And I would have to kind of put those in a box and like stick it in a closet somewhere, because if I actually reckoned and thought about those feelings, I don't know that I would have the strength to try another round, to try another IUI, to go back to my doctor and go through this loss all over again. Not to mention just how physically hard it is to do this. You're putting shots in your stomach. I mean, I remember there were times in cycles when I was stimming for 15 days. I was putting 3 to 5 shots in my belly every single day, still working a full-time job that happened to be in front of millions of people every single day on the Today Show. I was having to get on a red eye to New York from LA because I needed to do a 24-hour turnaround on a story. And so I was really bad at processing all of that emotion and even acknowledging the loss that I was experiencing. And this is something that's really important to me. I've heard so many people say to me about IVF, not maybe me in specific, but you've never miscarried. And they're right. Factually, I've never had a miscarriage. But I've spoken to some doctors and I've spoken to incredible nurses, and they're like, every cycle, every transfer that doesn't become an actual viable pregnancy is in some way a miscarriage. Mm-hmm. And I think about how many embryos we transferred and how many of those embryos didn't make it, and how many eggs we lost just getting from egg to embryo to blast. And that's loss. And we need to normalize loss from the very beginning. It's not just because you have a miscarriage that you suffer a loss as a woman. I can tell you this, the embryos that were transferred into me were very much my babies, all of them, every single one. And, to process that loss and acknowledge. And I also think just to create a space for women to share that is really important. Thankfully, we're starting to normalize the conversation around miscarriages, which is so, so important because it happens to so many of us. But we need to think before pregnancy, like what's really happening before that in our bodies, and allow the space to process that loss and trauma. So sadly, I did a terrible job of doing that. And I also spent the first trimester of my pregnancy really sad, feeling depressed because I was finally pregnant, and all of those feelings that I had packed away for years, we're talking almost 6 years of my life, it's over 2,000 days, all of a sudden came rushing back. And now here I am pregnant, so grateful and blessed to have this incredible miracle. But at the same time, I had to process all of the loss and trauma that I had pushed aside for so many years. And it was really hard. And I'm still dealing with that now. So the mental health element of this and being really proactive in seeing somebody and talking to somebody as you're going through this, I cannot stress how important that is to the success of whatever journey you're on when it comes to reproductive health.
Yeah. Thank you so much. So you did all your work after all this work to get to the day you largely did after you were pregnant.
I did. I mean, I wish that I could go back and change that, because I think it would have been a lot easier, but everyone's on their own path, and you make the decisions that are right for you in the moment. And I'm okay with that. I'm okay with dealing with that now. I think that you take what you process what you can take at the time when you can take it. And I wasn't ready for it at that time.
Plenty of people pack it away forever. So I commend you for not. And then I want to get to Karen, but I do want to hear just a little bit about, we talked a little bit about this stereotype. You are here in today also to sort of represent the Latinx community. And we talked a little bit about those stereotypes. Tell me a little bit, I mean, you touched upon this a little bit, like, why do you think they exist? And sort of, again, or I've already said, sort of dispel that they aren't true, but why do you think that those exist, and what do you think we can do about that?
Yeah, well, I think to start, I think religion plays a really big role in this. I was raised in a Catholic family, and people have opinions about using advanced reproductive technology to get pregnant. And so I think if you have people in your family that are religious and they practice and they're firm in their beliefs, which is a beautiful thing, I think sometimes it can create a barrier to communication, and people put up roadblocks around that. So number one, I think that has a lot to do with it. Number two, I think that the Latinx community does not like to talk about sex. We like to talk about it in places where we're comfortable, like our sexuality and being, like comfortable that, but we don't actually like to talk about sex. We don't like to talk about periods. We don't like to talk about anything, as long as when you're married, it's only to procreate. That is when you have sex. That is the only time that we talk about it. So I think that is part of it too. And I just think it's also very generational. I think that for whatever reason, my mom, her sisters, the older generation didn't have the space to talk about it. And I like to think that it's because they just didn't have the education to talk about it in a way that felt really comfortable, and that just made them feel empowered to have these conversations. And that's why I'm just so happy to see these conversations happening in women my age. I'm 41. My cousins who are younger, and just young Latinx women that are willing to have these conversations. I think it's also a very kind of male-driven culture. So a lot of times with fertility, as we know, 30% of infertility ends up falling back on the male. But to even suggest, I can surely attest to this in my household or in one of my aunt's households, that something is wrong with a man and he's unable to, provide the right kind of sperm to get his wife pregnant. That's just not a conversation that any of my uncles or male cousins are willing to entertain and engage in. So I think all of those factors add up to just this real silence around something that affects us all. And I love what you said about the fact that it's not that Latinas aren't that have more fertility. It's just that we don't ask a lot of questions about it, and we're not as proactive as our non-Hispanic white friends that do talk about this in their households, that do seek medical care for this. And then the sad part, I think, is also, I think that certain physicians are discriminatory in their practice. And I think that they use someone's race. I think that they use someone's insurance carrier as a reason to not refer them to a reproductive specialist, because they make the assumption that they can't afford it, or that they're not interested in that. And so all of that, it's a lot to dismantle. It's a lot to unpack. But I think that's what leads to this incredible stigma. And the more I talk about this, I even see in the comments, people are saying, oh my gosh, this is exactly my family. I'm half Mexican, half Puerto Rican. But I can tell you that my Colombian friends experience this. My Dominican friends definitely experience all of this. My friends from Brazil, same thing, so while we are all individual and represent different countries, I think in the Latinx community, these are stereotypes and stigmas that we kind of have to join forces to battle, because it feels like we've all experienced some version of this. So for everyone that's in this room that represents that community, please have those conversations. Please start the conversations. We've been having really important conversations in the last year about race in the Latinx community, the racism that exists. This is just another one of those difficult conversations that we have to have.
Yeah, thank you so much. And I think, from my standpoint, access is an issue, and whatever your comments on that sort of barrier to access are very, sort of profound. But I can tell you, as a provider, and there's even data to support this, that, women, Latinx women of color are less likely to just access fertility care. And I think that's a battle I know you're trying to fight. And I know we appreciate that in us at Kindbody too. I mean, I think that it should be all of our goal to improve access for everybody. Everybody should be getting that information and working hard to dispel all of those stereotypes. So thank you so much, Lillana. It's so wonderful. I'm so excited for you.
Thank you.
I'm sure our group will have more questions for you, but I want to ask Kara a few questions too. So Kara has a different kind of journey because she's not actively seeking pregnancy now. And if you talk to Kara, which you will do right now, I would venture to say she never would have sought this information had she not happened to be an employee of Kindbody. So she got a job and it forced her to start asking these questions and to seek the information. And then, she has herself taken similar information about having low egg numbers that she never was actually actively looking for, and then has subsequently had her own journey. So Kara, we would love if you could tell us sort of how it started and what it's been like for you.
Yeah, thank you, Dr. Brower. And thank you also, Lillana, for your bravery and having this conversation. And the combination of strength and vulnerability inspires people to be proactive in their journey. So my journey is a little different. I joined the Kindbody team about 2 years ago, and I took my first fertility assessment. And at that point, I found out that I had low ovarian reserve. But for quite some time, I resisted kind of addressing it for a number of reasons, mostly because I'm not in a relationship. I'm not thinking about having kids right now. But as I continue to work at Kindbody and hear stories like yours, Lillana, and so many of my colleagues, I just became really inspired. And I had all this information now. I knew all the success rates. I was selling it. I was working to create access to care. So with some very kind nudges from some of my colleagues, I was encouraged to do another fertility assessment once I made the move out to California. And I did find that my numbers were in fact lower as expected. And my numbers were that of, someone who was 10 plus years older than me. So it definitely motivated me to get the wheels in motion and start the process with my fertility journey. And so I went into it again, knowing all this information, all this knowledge, from just being part of my everyday life. And I did make the choice to be pretty public about my journey because I've been so inspired by all these stories, and I know how much that really encouraged and had something to do with me proceeding, and also the fact that Kindbody supports and sponsors their employees to cover these services. I don't think if I didn't have this opportunity, it wouldn't even be part of the conversation for me. So I started the journey, and it was so incredible. The more I shared, the more support that I had, not only from the people that I work with, but the entire Kindbody community. Rebecca Silver, who is our VP of brand, she encouraged me to start posting on my stories. And at first I was a little hesitant to do it, but then it just really I wanted to share with everybody what I wish I knew before I started. And I already knew a lot, but I just thought it was so important because you feel so many feels throughout the journey. And Lillana, when you said it's a real act in surrendering, because there is even though it's such a personal journey, and the averages and all of that, you expect your body to react in certain ways, and mine just wasn't. My follicles were going pretty slow, and Dr. Brower and her whole entire team were rooting my little follicles on to grow, and it was just really awesome to be surrounded by that support. But I felt really bad. I felt like a failure in some ways when I had to do the 16 days of stimulation, and it was just having the outlet to talk about it and really continue to get all the information and contextually understand what each step of the process meant really just destigmatized the whole entire process for me. And then I felt like it was my duty, because I had this opportunity, to start sharing about it and start talking about it. And I forget, because every single day I talk about fertility, but I forget how many people don't know these things and aren't even thinking about it, and don't even, like, I was talking about a cycle and my friends were like, what's a cycle? And so I had to explain, it's a two to 3 week period where you're stimulating your ovaries and you fake an ovulation and all that. So it's just really, I'm really proud to be part of such an awesome company that truly is really empowering, educating women to take over their health. And it's a completely different, I didn't expect to feel as empowered as I did. I thought I was going to have a little like, woe is me, I'm single, I'm 30, I have to freeze my eggs, but I really didn't. It really allowed me to like feel like I was intentionally and proactively taking action, and like allowed me to be proud of my journey. And so it was like a major practice in like self-acceptance and really just embracing where I'm at. And so just to summarize my story, this is something that I always say, is that the empowering feeling that I felt, I was so proud that every single day, that's my job. My job is to create access for this feeling of empowerment and like being your own advocate in your healthcare journey. So it was just really awesome. So I'm really grateful to be part of this amazing, amazing team and part of these conversations, because we need more of it.
Thank you. Thank you so much, Kara. And I do think one of the things you said that sort of struck me is that the more you share, the more support you got. And Liliana touched on this, and I can attest to it too. It's really hard to share. Like in the moment, sometimes it actually feels impossible to share. And you don't have to share with, everyone's sharing might look different. Maybe you have a big social media following, or maybe you're just sharing with a smaller group of people. And sharing, it's hard. This is a feeling of shame, and it is really scary and hard to do it. But anybody who you talk to who's ever had any kind of journey always reports that back, that if you share, support pours in. And I think that support is essential. And I think a lot of people do travel this journey alone. But I would encourage anybody who is having a hard time to share somewhere, to access support somewhere, and support, like you said, Liliana. Obviously, you've done some really important work with a professional. I actually think that should be mandatory, that anybody really having a journey like yours should be having professional support, but sort of more informal support too, from other people who can really, really identify with how you're feeling. And whether it's in one of these groups or a smaller group, Tracy and I did this great little event the other day with these like 10 or 12 women who were all, I don't know how they found each other, but they were all, once a month, they just got together and were just sharing. And in that sharing came sort of like an outpouring of support. And I do think that the support is essential. It's a very, very universally isolating experience. And it's important to allow yourself to not be isolated. And it's really hard. I remember I once had a patient who was a breast cancer survivor, and she had actually made embryos before she went through chemo, and then she broke up with her partner and now was coming back with her new partner and struggling to get pregnant. And she just was like, when I had breast cancer, people wore pink and they marched for me, and everybody was this outpouring of support all the time. But when she was struggling with fertility, she was isolated, and she said she felt like it was a harder journey to travel. So I don't know. Thank you to that. Thank you so much to both of you for sharing your personal stories today. I think that I would encourage anyone sort of having a journey to do the same in some setting. So we're so grateful to both of you for sharing today. And then Amanda, when we have a few minutes, do you want to have any questions come up that you want?
Yeah, I do. I have a couple questions. So I thank all of you, the three of you, so much for sharing today and going through the presentation. I think it's so important, as you were saying, Dr. Brower, like sharing. It's the reason we titled this event, Sharing is Caring, because it is a way to connect together. And I think the more that we share, the more that everyone else realizes they're not alone. So even if someone is not willing to share their story, to see that other people are sharing their stories, it reminds them while they're at home and feeling really isolated that they're not alone and that there's other people who are going through this. And maybe it gives them the opportunity or it gives them the encouragement to open up to their partner, to their friend, or maybe even to their coworker or someone else and feel not alone. So thank you. First, for people who are going through infertility, like Lillana, this is more targeted towards you or posed to you, but like, what do you want your community and your friends and your family to ask you? Because I don't think everyone wants to be asked about their ovaries every single day when they're going through this. Like, how do you want your community to support you?
Yeah.
And how we can support people going through this?
Sure. So I can speak for myself. I know everybody appreciates support and kindness in different ways. The last thing I wanted to talk about was my ovaries. They ruled every action, every food that I ate, every free moment that I had. And obviously in our household, my husband and I talked about my ovaries all the time. So for me, I think any kind of escape from that was really welcome. And I know that how are you doing? How are you feeling is obviously coming from a beautiful and wonderful place, but I would have been like probably more receptive to, oh my goodness, did you watch Real Housewives of New Jersey last night? Can we break it down over wine? And at least it would have taken my mind off of the journey and battle at hand. And then, I always say this, I think that actions speak louder than words. And oftentimes if somebody's going through this in your office or a good friend of yours, and they have a favorite chocolate chip cookie or they have a favorite kind of ice cream, just send it via Postmates and just with a simple note that says, I'm thinking about you. I love you, sending you like an ice cream hug. That stuff means so much. And don't hesitate to do that. You're not being invasive. It's just, again, like, I think that action when it comes to kindness is always so welcome. And honestly, sometimes I just didn't even want to talk. For me, I talk for a living. So I'm like exhausted by the end of the day. I don't want to talk, but I will always throw down for a pint of ice cream.
Same. And I'm not going through what you are. So, Kara, what about you? So going through something like this on your own, like what's the one piece of advice or one piece of encouragement that you want to offer to women out there who are thinking about what their fertility options are and what they should do if they want to, have the option to have children in the future?
Yeah, I definitely think that talking about it is, like we were saying, sharing is caring. I think that definitely destigmatized, but also what really helped for me was getting out of my head and starting to take action. And so for me, I actually didn't like the act of taking the shots every single night allowed me to get out of my head. And so once I did the shots and then I went through that, I went through the whole mixology process where I'm like, am I doing this right? Am I messing something up? Did I mess something up? And that's why my follicles aren't growing. But I think just like getting out of your head and taking action, whatever that means to you, whether it's just getting serious about, hey, do I even want to have kids when I'm older? And like just trying to preserve it in that way and just getting out of your head and taking action, I would say. But Lillana, I agree with you. My Kind Body family sent me a lot of gifts throughout the process. And it really made me feel like, seen and heard and cared for throughout it. So I think it's just having that support system around you and making sure that, you're getting that TLC that you need when you're going through the process.
And thank you. Well, that's really helpful. Lillana, we saved the best for last. Can you tell us a little bit about your exciting partnership with Kind Body and why you wanted to partner with us on this campaign?
Absolutely. Well, what I know about Kind Body is that access and education are paramount to your mission. And when I saw that, I thought, okay, this is exactly who I want to share this awareness with. And I want them to help me actually bring these services to this community. So I'm so excited that you guys and I have partnered together to provide a fertility analysis at no cost to a dozen women in the Latinx community. We're partnering with one of my favorite charities. This charity is dear to my heart. They are boots on the ground. They are trusted. They are resourceful. They care so deeply and passionately about the women in this community. It's 100 Hispanic women. So they're our charity partner in this, and we're going to work together to find women that represent all walks of life, whether you're ready to have kids, whether you're thinking, I'm better as an auntie than a mom, regardless of whether you have a partner or you're single. It's really just about giving women this education and access into their own reproductive health. And so I'm excited to be doing that with you guys. And then taking it one step further, I remember how difficult Mother's Day and even that entire week always felt for me year after year after year. And this will be the first time that I get to celebrate Mother's Day in the way that I always dreamed about celebrating it. Next year will be even more special, but something about this year feels really, really special. But I remember how hard that weekend always was to participate in those celebrations, to see all the Instagram posts. It was really challenging, and talk about isolating, especially when people don't know what you're going through. And so I'm excited to also share that in paying it forward, we are going to find a couple to help support through this process financially with one free round of IVF. So I'm really excited to be able to do this. Thank you guys for being so incredibly generous with these services, and for really allowing me to focus in on this community that I love so dearly and really want to help. So thank you.
No, thank you. Using your platform for good is something we're so proud to partner with you on. So thank you so much. And I thank everyone here for joining us. This is a really special week for everyone. And I know there's so many events you can attend. So we're so glad that you joined us tonight. And we're so happy that you guys are with us today and part of the Kindbody community. And we can't wait to see you in a clinic soon. Lillana, Kara, Dr. Brower, thank you so much for your time, for sharing your stories. And we're just thankful for everyone. And we wish everyone the luck on their journey. And Kindbody is always here for you. Thank you guys so much.
Hey guys.
Thank you all. Bye.